Hello, my name is Jennifer Goday. I'm a nurse practitioner and owner of Everyday Wellness located right here in Wichita, Kansas. Today we're going to be talking about, you guessed it, hormone optimization and the road from fatigue to vitality. Are you tired of running on empty? Are you over just barely surviving and ready to start thriving? Well, good news, hormones plays a big role in this process, and that's something we can manage and optimize fairly simply. It just looks a little different than what you're used to. Traditionally, we're used to just going in to making an office visit, seeing our doctor or whichever provider is in the office that day, saying, hey, I just don't feel great, something feels off, I'm a little bit more tired. They'd run labs, call you back, and usually say, everything looks good, see you next year. And then what do? We're left there just in limbo until next year. We know something's off, right? Nobody knows your body better than you. So here in our clinic, we basically will take your symptoms, draw some labs, do a thorough exam, and get started on your personalized treatment plan. What's the opposite of optimization? Imbalance? Fatigue? Empty tank? Got nothing, right? Running on fumes? Well, those symptoms are going to look like what you would imagine. Fatigue, poor sleep quality, decreased libido, maybe some decreased sexual performance, weight gain, difficulty in building lean muscle mass, mood swings, anxiety, and brain fog. Duh. So what you're going to do if you're interested in talking about this with your local provider is, especially for me, you are going to go to the website and you're going to book an appointment and come in for a consult. So basically you'll come in, kind of talk to me about how you're feeling, what symptoms you're experiencing, any kind of questions you may have. We're going to review some family history, things like that, your past medical history, and we're going to do a little exam, draw some labs, and then of course we'll bring you back for a follow-up because we're going to want to tie all that stuff together and kind of figure out, okay, here are your symptoms, here's your family history and your labs, and here is what we can do. Right? It's basically putting all the pieces of the puzzle together to get a nice, perfect, well, let's not say perfect, but a nice, healthy image of yourself. So what do treatment plans usually include once we've done this, right? So we've done the exam, we've gone over your history, we have your lab results back. Well, you're going to come back in for that follow-up, whether you come in person or we do it on the phone, and we're going to say, hey, you know what? Your labs support what you're saying. And this is what I recommend. So oftentimes it will include some nutritional guidance, right? Because we need to learn how to feed our body. Our body on the cellular level really wants to just keep us alive long term, right? It's about surviving. However, today we're talking about thriving. So it's not just about getting by. So basically we are going to feed our body and hydrate it. That way it can perform optimally. So if we're going to be doing all these things, optimizing your hormones, we have to give your body what it needs to thrive as well, not just us. So we need that body happy as well. What we're going to do is talk about being protein focused. We're going to talk about exercise, how to build lean muscle mass, because muscle equals longevity. We're also going to talk about water intake. Most of us in this country are dehydrated, even if it's just a little bit. So we're talking about, again, feeding your body good nutrition, keeping it hydrated. We're going to talk about good quality sleep and building a good sleep hygiene pattern. And then if appropriate and necessary, we're going to talk about your hormones. So what I like to do is I use BioTE. That's the brand of hormone replacement pellets that I use. I highly encourage you to do pellets. They're my favorite method and delivery system of hormone replacement, but you will have options, of course, and we'll talk about those in the office. If you opt to do pellets, then we basically just come up with your dose. Well, pellets, creams, whichever. We are going to figure out what your dose is. We're going to powwow together, make sure you feel comfortable with everything, and then we're going to move forward with that treatment plan there. So if you opt to do pellets, that procedure is very, very simple. If you are a female or male, you come in, we make a very, very small incision. It does not require sutures at all. We implant these pellets. What happens then is capillaries form around those pellets. That way, every single time your heart beats, boop, that blood goes over the pellet, and it picks up the same amount of hormone consistently with every heartbeat. So your hormones now look like this instead of that up and down roller coaster or, nothing. So now that we have those pellets implanted and now your hormones look like this, over time, what once was an empty tank is now slowly starting to fill back up. So your body has what it needs to pull from for all your hormones to be working optimally, whether it's the sex hormones, the thyroid, everything works together in either a positive or a negative feedback loop. And now you got a full tank of gas to work from and to pull from. Once we figure out what your dose is for your hormones, we're going to talk about some supplements as well to help you process those hormones correctly. That way we don't have additional conversion into estrone, things like that. Whether you're male or female, we really don't want some extra estrone because that's the form of estrogen that likes to live in our love handles. And the whole goal is to get overall healthier and get rid of some of those love handles. And obviously, if you are a bio male, you don't want increased estrogen anyway, right? So once we get your dosing figured out, we get those pellets implanted or the injections ordered for you. And then what you're going to do is wait for that phone call to come. In about a month after implantation, I'm going to call you and say, hey, how do you feel? And you're going to let me know. If you are just on the road of feeling back to your normal self, saying, hey, I am sleeping better, I am more motivated, my energy is getting better, then I'm going to see you when you're due for your next round of pellets. If you are not kind of getting to where we anticipate you to be about 4 weeks in, then I'm going to bring you back in and we're going to do your labs and say, hey, maybe we have to alter that dosing. Maybe we need to bump it up a little bit. Maybe you're doing too good and we got to space out your next dose. So it's, again, very personalized and based off of you and how your body metabolizes these hormones that we get into your system. So lots of lab work. Well, lots. I say that to support the fact that it's going to be very personalized. It's not going to be like, okay, it's been 3 months, you're going to come in, get labs, and then, just keep you trucking along. It's basically going to look like, okay, you are due for labs. You're going to come in, draw those labs. I'm going to see how your symptoms are. We'll do a little exam, and then we're going to figure out, okay, is the dose that we did the first time correct, or do we need to alter that? Are you feeling good or you're not so good? We're going to figure that out as we go. So here's how the timeline looks for a female. You come in, you do your first appointment, we do that exam, labs, symptom checklist, and then we get you on the schedule to come back to get your pellets inserted. When you come in for that appointment, we are going to review your dosing. We're going to go over that procedure again, fill out some consent forms, and we're going to get those pellets implanted. That procedure itself takes about 5 minutes. You're going to go home. You're going to recover in about 3 days. You're on a gluteal restriction and a water restriction during that time. That just means you can't submerge in water. So no swimming, no saunas, no hot tubs or baths. Showering is completely okay and encouraged. And then you also can't do any activity that's going to activate that glute muscle, allowing those pellets to really solidify and find a new home where they're at. After that, for females, again, on average, we're going to get pelleted about every 3 to 4 months. So in about 3 months, I like to bring you back in and see how you're feeling and then redraw some labs and see where your labs and your hormone levels are at that point in time. Once those labs are back, we're going to have you come back in and decide, okay, here's your new dose or the same dose, get them implanted, and then we'll get you on the schedule. Once you come in for that second pellet, I'm going to have a much better idea of if you're going to be an every 3-month pelleter or if you're going to be an every 4-month pelleter. And we just really genuinely base this off of you and how you're tolerating those pellets. If you are a male, it looks very similar, but obviously men are always going to get more testosterone than females need. So you're going to get a few extra pellets of testosterone. The only difference is your recovery time is going to be more closer to 7 days than 3, and that just allows you to have more time to get that incision healed and get those pellets nice and implanted in that fat tissue. That way they don't want to move anywhere else. They want to just hang out there where we put them. After 7 days, you're going to take that dressing off and go back to normal activities. But the same process will, other than that, is going to be the same for the females. So in 30 days, I'm going to call you, see how you're feeling. And again, if you're feeling as we anticipate and we talk about it and you're like, yes, I am exactly where you said I should be, then I'm going to bring you back in about another 5 months, 4 or 5 months, depending. And then at that point, you'll come in, we'll do some trough level labs, A trough lab basically is what are your levels now versus a peak. If we do peak levels, we usually do those about 2 weeks after we implant pellets to see how high have we gotten you? Have we gotten you high enough? Really the good way of doing, in my opinion anyway, is to get a trough level. And that means I want to draw your labs now that you're due for another round of pellets to see how far did you fall? Because maybe you're not back down to zero anywhere. Maybe you only fell halfway. Therefore, we need to adjust that dosing, because if I give you that same dose and you don't need that much, then we're going to give you too much testosterone and you won't feel good. So again, it's not to just say, here is a piece of paper with your labs. We're going to do this, this, and this. You are a person and we have to really make it specific to how you are feeling. So once that gets done, we have your trough level labs. We're going to bring you back in, figure out your dose, and pellet you. After your second pellet, I'm going to have, again, a really good idea is if you are going to be an every 5-month pelleter or an every 6-month pelleter, but we always kind of just base it off of your lab levels and your symptoms. If you are feeling good and your labs are within range, then we say, hey, I'm not going to pellet you right now. I'm going to push you out, 4 weeks and then bring you back and see if you're ready at that point. And that is going to help prevent some of those symptoms that we see when your hormone levels get a little too high. Because again, we don't want to just ramp you up. We've got to get you in that happy zone. So that kind of covers that procedure of coming in, discussing symptoms, doing some labs, giving you some lifestyle change recommendations, getting your pellets inserted, and then getting you on a good rotation of, I'm going to come in and get my pellets. I'm due. If this sounds like something you're interested in, I highly encourage you to find someone that is willing to do this process with you, kind of really get in the weeds with you and get you feeling optimal again. So if you're located in Kansas, especially if you can get to my office, I would love for you just to see below into the video description. I have a link down there. You can go to my website, make an appointment to do a consult, and we can get you started. If you are not local to me, again, highly encourage you to find a functional medicine provider that will help you get your hormones optimized. Thank you so much for listening to this video, and I will talk to you next time.